Tonight we're gonna dive into how to prepare for your first day on hospice. All right, so you've got the call from the nurse, you got a call from the social worker wanting to come over, you get a follow-up phone call from the chaplain asking when can I schedule a meeting, and then you get a phone call from the CNA asking, okay, when can I meet you? Now it's up to you, the patient and the family, to decide who you want to see that first week after just being admitted on hospice. Yes, you need a breather, you need to compose yourself, you need to sit down and take it all in because it's just so much. It's understandable. And it's all right to say to the social worker, I'll take myself an example, thank you for calling me. I'm not in the position or I'm not ready yet to receive your visit today. Can we schedule sometime later this week? It's perfectly fine. Now, I have to say the nurse, the social worker, and the chaplain typically have to get that initial visit and to simply state, yes, I met the patient, and the patient either receive or decline my visit. But it is, for Medicare purposes, it is essential that your disciplines come out and meet you to say, yes, they did attempt to. And again, you are the one in charge of your care and the one who will direct and say who you want to see, who you do not want to see. Except for the nurse has the duty of coming to visit with you at least twice, 2 visits per week, 1 to 2 visits per week. Now with the social worker and the chaplain, you can schedule as you require. It's usually 1 to 2 visits per month. But again, I explained on a different video that the visits fluctuate depending on the need of the patient. So you really don't need 2 visits per month. It can be tapered down to just 1 visit. If additional visits are required to address certain issues, then that's a discussion you would have with your social worker and the chaplain to increase those visits. And then you have your CNA. So all of those disciplines are coming in that first day or first week that you've been admitted to your hospice care services. A lot. How do you get prepared for all this? Well, number 1, ask about the folder. You need your hospice folder, perhaps for yourself or family members, to go along with what's being provided to you, to know that it's inside your folder and that you have additional information in the folder should you need to review the information provided to you. Number 2, take a deep breath. You need to take a deep breath. This is your personal space, your personal time. Take a deep breath, relax a little bit, and understand that the disciplines who are coming from a place of trying to provide care for you and services for you. Yes, it is overwhelming, but it's simply an effort on their part to try to get everything that you need, the resources that you need, to make sure that you are progressing in a healthy manner on hospice services. How else can you get prepared? Ask the individuals who stop by, can you please write your name on my folder? Or may I have your business card? Some may and some may not have a business card to provide to you. Keep that business card handy. Some may even have a magnet for your fridge. Put it on your fridge, that way you know who's coming. Now, I always suggest to my family members, get a calendar. Get a sizable calendar for your wall or for your fridge, and simply write down the days that you are expecting a visit from your nurse, your chaplain, or perhaps you may just want to put hospice on that calendar. So if you decide Wednesdays are your best days, you may want to circle Wednesday and say, okay, these are the days Wednesdays scheduled for my hospice team to stop by. And we've had patients who, let's take for example Wednesday. That Wednesday, they knew from, let's say, 11 in the morning till 3 p.m. they would get visits from the hospice team. Or perhaps you want 2 days out of the week to receive a visit. If there's nothing else going on, no pressing matters, you're doing fine, and all you need is just the routine visits, schedule it according to what works for you. If there is something going on, then of course, as I mentioned on another recording, call your hospice care provider immediately to get assistance and for them to tell you how to best manage what is taking place. Okay? So the best piece of advice I can give to anyone listening to this about that initial first day or week on hospice is to get a calendar or pull out your hospice folder that will identify what is to be expected, the team members. But that calendar and that folder, you're going to write down the names of your disciplines. Who's the nurse? You want to know the name of the nurse? Write it down and put nurse next to it. You want to know the name of your social worker? Write it down. You want to know your CNA? You want to know your chaplain? In the event that you need additional services or immediate contact with these individuals, you're going to call hospice and say, okay, I need to speak with my social worker. His name or her name is X or Y. Same thing goes for the nurse, same thing goes for the chaplain. That way you know who your team members are and they're easily identifiable. And also if they call you on the phone and they say, okay, we'll take a name. This is Tom, your chaplain, calling to see how you do. I'm just following up with you. It's just a phone call. And I wanted to see how you're doing. This is your visit. If at that time you want them to stop in, say, Tom, I would really appreciate you coming in this week if you have time. Guess what? They will make time for you. Again, we're talking about how to prepare for that initial first week, which is going to be overwhelming and packed with phone calls, people coming in, supplies. I forgot to mention supplies. You have supplies coming into your residence. If you are within your private home, you get in deliveries of your supplies. Maybe it's a medical bed. Maybe it is a high rise that you need for your toilet. Maybe it's a bedside commode that's required. Maybe it's a wheelchair. Maybe it's a walker. Again, there's so much coming in within that first week to make sure that you have the resources that you need. You may get overwhelmed. It's my point to you, and I want you to know the best way to tackle that first week is to sit back, take a deep breath and say, they're simply doing this to help me get the most while I'm on hospice care. And that's going to make things so much easier and less complicated for you and the staff coming in. Right? And if you're not at a place where you can say, okay, they're just coming in to do what they need to do, schedule the day that works best for you. All right. I hope this was helpful, and I look forward to bringing up more topics about hospice care, the 5 types of diseases or diagnoses that we commonly see on hospice services, and other helpful hints to make your journey on hospice far more pleasing than what individuals may think hospice is about. Because there is that negative connotation, and that's why we have this show. There is that negative connotation that hospice means my loved one will be gone within 2-3 days. That's not the fact. That's not true. It depends where you are on your progression, your disease progression. But for the majority of the time, it all depends when you come on services. You're with your hospice team for about 6 months or less. Thank you. Have a wonderful rest of your day. Thank you for joining me.